If you hang around in health policy circles, you'll eventually see the graph, and you'll probably see it lots of times, projecting the expenditures of an aging society forward until at some point in the future we do nothing but look after older people. This graph is wrong. The Observatory has published much work showing that responding to the healthcare challenges of an aging society is not going to be a particularly difficult problem. But the myth persists. The myth persists that an older society is one that is necessarily going to be more expensive and have an unsustainable health system. We puncture a few of the myths. We break it apart, because it comes down into a series of misconceptions, and if you rebut them, we can move to a new and more productive understanding of healthcare in aging societies. First of all, there's the myth that older people are more expensive for the healthcare system. They aren't. They tend to have cheaper diseases. What's actually really expensive is death at any age. The second myth is that older voters are a bloc, that they vote en bloc for their own benefits, for their own preferences. We show that in most countries, this doesn't actually represent reality at all. There's very few countries where older voters are anything like a bloc. And that makes sense when you think about all the divergence, all the different ways in which people age. Their family settings, their economic situation, their wealth, their race, their gender. Older people are no more a bloc than young people. Furthermore, do they vote their interests at the expense of younger generations? No, they do not. Instead of looking at intergenerational inequalities, what we look at are all the other inequalities that shape the politics of aging. So, for example, wealth inequalities in a society shape attitudes towards the welfare state and healthcare services. Gender inequalities shape these attitudes. So, in many ways, setting generation against generation, positing that there's some kind of intergenerational competition over health resources, is only serving to obscure what's really going on, which is in many ways the politics of inequality, the politics of income, the politics of race, class, gender, immigration, and all the other things that animate us. So no, your grandmother is not the problem. We call for our life course policies, which begin before birth and go to the last day, in order to maximize people's health and well-being and ability to contribute both to paid and unpaid, often caring labor that makes our societies go around. Thinking in terms of life course solutions, for example, a better and more professional and kinder caring sector that takes the burden off of women who often have to care for older people, is a way to invest in a stronger labor market, happier children, and broadly, a healthier society.